The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. Tonight we have a good news, bad news program. The good news is that New Yorkers are living longer. A report from the AARP, American Association of Retired Persons, says that there are now more of us 65 or older than there are children who are under the age of 13. But according to the report, the bad news is, as the population has aged, there are disparities as to who is being impacted by some very obvious concerns, such as high prescription drug costs, utility bills, and also less understood factors like the cost of caregiving and even the impact of the gentrifying Bronx. Tonight, a couple of experts in the aging population will join us to analyze that AARP report and also give us an on-the-ground look at how Bronx seniors are doing. Please join me in welcoming the New York State Director of AARP. It's Beth Finkel. Nice to have you with us.
Great to be here.
And also the VP of Physician Outreach at Riverspring Health Plans. It's Bob Manley. And Mr. Manley, nice to have you.
Pleasure, Gary.
Ms. Finkel, let's start with you. Now, I went through the report. As you know, it is called Disrupt Disparities 2.0. And just to give the credit, it is in collaboration with the Hispanic Federation, Asian American Federation, New York Urban League, and NAACP of New York. But why don't you start with the 1.0 report? Talk about what led to the second edition, what you discovered in that first one, and then ultimately what, you know, the resolve to some degree is this time around.
Well, it won't come as any surprise to you or people who are watching the show that New York excels at a lot of things, right? Our Excelsior is our motto, right? And the one thing that can't be
We're all proud New Yorkers.
Right, except that there's one fact I'm going to give you. The top 1% of earners in New York State earn 45 times what the next 99%
Wow.
altogether, right? So what happens?
I didn't know we were going there, but
right,
okay.
Well, because honestly, how are you going to pay for your health care? How are you going to pay for your prescription drugs? How are you going to pay for caregivers? If you're living a longer life, everyone's going to need some help at one point or another. And if your neighborhood, the costs are increasing, right? And your landlord all of a sudden wants to get more money, more rent from your apartment. I mean, that's gentrification of communities. So when you look at all those factors, what's the one thing in common? Do you have the income to maintain your lifestyle? Right?
And I guess on that's one side of it, but there are support systems. And
Yes.
support systems, I talked about drugs and utility bills and all those other things. What did you determine last time around that was of significance? And I know, and maybe you want to brag about it, there were some actual changes. I mean, some of the rent reform that we've
Yes,
seen
rent
as a
reform.
result of that. But talk a little bit about that, and then we'll bring it right up to date.
Yeah, so there was legislation passed, rent reform. It's the biggest rent reform in the nation, and not just New York City, by the way. It affects upstate regions too. So that's been great. We also found that people were not able to save for their retirement. 50% of people who work in private industry in New York State actually can't save in the workplace. They don't have a 401k, they don't have a pension, so they're not really saving for their retirement. They're going to wake up one day and not have enough money put away. So we did get legislation passed through Governor Cuomo and the House and the Senate, and we're very excited about it because now people will be able to save in their workplace.
You know, and maybe Mr. Manley feels the same way, but the first thing that you said, which frankly, as I indicated, was a surprise to me about, you know, the gross disparities, which were, you know, economic disparities. And now as you're talking, I'm saying, oh yeah, that is the bottom line. You know, oh yeah, that is the bottom line. So now you've done that, you've accomplished that. What brought us to this new one, Disrupt Disparities? You uncovered some disparities. By the way, one thing I do want to say about the rent reform, there's a lot of talk about developers not happy, real estate people not happy, but the fact is eviction rates, there was a report that showed eviction rates have gone down.
That's right.
And that's part of what you're saying. Anyway,
Absolutely right.
So let's talk about 2.0.
So in 2.0, we looked at the high cost of utilities and how communities of color are impacted more than others. So you have less discretionary income, your income is lower, and then you get an increase in your utility bill. Con Ed goes up. What can you do? There's nothing you can do. You've got to find that extra money to pay that bill. That's right. Caregiving, we know that most people, they want to remain in their own homes. We've surveyed them. Almost 90% of people consistently tell us they want to age in place in their own homes and communities right here in the Bronx. And we know that because we've got such a high amount of older people here in the Bronx. And why shouldn't they be? They built these communities. They love it here. So why wouldn't they want to stay here? But they need more supports in place to be able to do that. And so we looked at the families who are helping. And you mentioned that you help your mother, right?
We do.
Right? You do some caregiving services for her to make sure she can stay where she is. Well, that costs money. People pay a lot of money out of pocket.
And I think also, and I'm going to bring Mr. Manley into the dialogue, I think also that caregivers spend a lot of time, and for want of a better look at it, time is money, right? And that's, you know.
Well, that too.
So people say, well, you know what, mom's got to go to the doctor. What am I going to do? I got to take off in the afternoon to work. So, Mr. Manley, talk to me about what you find. So, you give me a conditional. She's laid the groundwork of the problems.
So one of the things, I mean, in many ways, we're more fortunate in New York than a lot of other states because years ago we decided, we recognized that people would rather age in place, be at home in the community rather than go to a nursing home. A lot of other states are coming along to that after us, but for a long time, New York State has had a moratorium on nursing home bed construction because the preference was to stay at home. So we've established that. Why? Because you're surrounded by familiar people and things and foods that you're used to and accustomed to and all of that. So the idea, and New York's Medicaid can tend to be relatively generous compared to other states in what we've done. Again, what we've saved on nursing home costs have been put into care in the community. One of the things you addressed about family members giving care to their loved ones. So New York State has also developed a program known as CDPASS or CDPAP, which is something that's consumer-directed personal assistance. So in instances, family members can be paid to become care providers, so they can be paid for the work they're doing for loved ones. This is in a Medicaid program, a long-term care program.
How sufficient are these support systems? And I'm sure Ms. Finkel is going to jump in when she gets a chance and say, this is what we're working on. Do you see people who get caught in it, they don't have even the kind of support to navigate the system? For goodness sakes, if you don't have somebody speaks the language, I mean, there could be any number of factors. What do you see?
It's obviously, it's very complicated to understand the system.
Yeah,
as a healthcare professional, good luck. As a healthcare professional, even for me, when I look at these things, it takes a lot of time to figure out and decipher some of this stuff. So for long-term care, for example, I mean, there's lots of resources in place, obviously the Office for the Aging and nyseniors.com and places like this where you can go to get answers. But what we see is frail elders wanting to stay at home, struggling to stay at home with the supports that are available. So they can get aid services, they can get transportation to and from the doctors, but you still
I
need
gotta
family
add more,
involvement.
so medical services, prescriptions. I
Right,
mean,
right.
even not feeling well or a little older, and or a cold
Right.
day, and they can't go down to the drugstore just to get them, even if they
Right.
can afford them.
Right, right. No, it's a challenge for sure, and often people feel that they're not being heard, and that's a go ahead.
I want to kind of bridge the gap here. So one of the things, and we're going to get back into it in a moment, is the notion of disparities that Ms. Finkel laid out, the economic disparities. She's, I'm sure, about to talk about the ethnic disparities, and I brought up language barriers.
Right.
Do you see, do you see the differences? Some people have a chance or a better chance than others. I mean, I guess
Sure.
you would, right?
If there's real family involvement, obviously they can add, they can help, they can advocate for. Often, if just a frail elder goes to a doctor and
into
the
your
communication,
office, yeah.
exactly, they come to the office, the communication can be an issue. If you need an interpreter involved with that, it becomes another layer of difficulty in getting to the real issues that you have. And so, obviously, if you speak a different language and the caregivers in the community, we'd love to have all bilingual, trilingual, multilingual practitioners. We just don't have that. So it often has to go through a translator. The expression, it loses something in a translation. If you have a family giver, that adds in the ability to translate.
But many don't. We know that.
That's true.
Ms. Finkel, so one of the things that I really enjoyed out of the report is it wasn't just, here's what the problem is, and I guess that's part of the AARP advocacy, is you propose some solutions. So let's just leave the gentrifying thing aside, because it's complicated, it's a large, it could be larger than prescription drug prices. But talk to me about, so now we know that people of color, people certainly on the lower end of the economic scale can't afford prescriptions. How do we deal with that, and what can be done? Of course, it's a national issue as well.
It is a national issue, and AARP is looking at it both federally, at the state, and at the local level. Just a real quick example, for prescription drugs, this is 41% of African American and blacks and 32% of Hispanic older adults have been skipping their medication over a 12-year period. They're either not taking it at all or they're taking it half the time.
We can translate that to numbers, but the percentages are
They're
staggering.
high. 41% of African Americans
are not taking their
and
prescription
32% of Hispanics.
simply because of the economics?
They can't afford it because the prices have just gone up so astronomically, and it's all about RX greed. We really have to stop the RX greed.
And so are we talking about legislative reforms there?
Absolutely. So
Give me
right
an
now,
example.
I'll give you a
again,
great
there's
example.
so many different levels.
I'll give you a great example, and I didn't know this before I got involved with the issue. Drug companies pay other drug companies who are going to bring generics out on the market, right? Generics are the same medicine, but
Wait, to
without a
not
brand
do it?
name. And it's called paid.
That can't be,
It
I'm sorry,
actually
that can't
even
be
has a
legal.
name, pay to delay. And we have legislation up in Albany that's pending right now that would stop this pay to delay. As a matter of fact,
I've never
your
heard that.
own
That just sounds
Biaggi
incredible.
is one of
Alessandra
the,
Biaggi, Senator
she's one of the
Biaggi.
co-sponsors of that legislation. We need to have more transparency with our drug prices.
If it is in effect on the local level and a company is in, Austin, Texas or somewhere else, that makes it a little bit difficult, right?
No, it doesn't make any difference because in the end, Americans are paying the highest drug costs in the whole entire world. I mean, that's staggering. We are paying
So
the
you're saying even if one state deals with it?
It has not, another example is importation. Canadians pay so much less. So we have proposed legislation that would allow importation of drugs from Canada for New Yorkers. The governor has spoken up about this. We believe that's going to happen. And it will have safeguards. But you know what? If the drugs are safe enough for Canadians, I think we could think they might be safe enough for us.
Well, the implications of that too, if someone's
I was
not
just going to
taking-
ask you, what are the implications?
So
Literally,
funny
my
you should
question.
ask. So one of the things is that someone's not taking their insulin because it's expensive,
And
and
that's
that
a
has
big factor.
that has
Yes,
skyrocketed,
that's
and that's
right.
an essential medication for diabetics. So if they don't take it, the blood sugar, the blood glucose spikes, and they can have all kinds of issues. They wind up though in the ER. And so now they
now-
may wind
now
up
we're all
being
paying for
admitted.
it.
And now you just add to that cost. It's just algebraic what happens with the
Well,
numbers when you go to the
you
hospital.
know what's interesting about that? We talk about people going into the emergency room with a cold because they don't have primary care doctors.
Right.
But here's kind of a germ of an idea, if you will, of just regulating the drug prices and look at the implication or the way that the companies handle it and look at the implications. I really appreciate that you brought that up. And you find, because I know that Riverspring has nursing and you work in nursing,
right.
you find people who are like you greet them and it's like, well, are you taking? And they're saying, no, we don't.
Sure, yeah, because
Wow.
we don't have it, and the decision can be, do I eat this or do I take this medication? And people are going to choose food all the time. So something needs to be done. And like you say, in Canada, why are the drugs? We are paying the highest prices, and it's what the market will bear. It's kind of ridiculous that we are paying that.
I think I want to ask you this question. I don't know how long ago, a year or two ago, we did a show about addressing diabetes in underserved Bronx neighborhoods. And there was a video that was shown, I think it was actually done by high school kids, which is why we showed it, that showed people who had diabetes and had no idea that they thought you could take a pill and eliminate it. They had no idea if they ate better or if they exercised more.
Right.
So I wanted just a quick word about education, health education.
Sure.
And we'll start with you. It's not directly related to what they're talking about in their report. What mechanisms are there for delivering the kind of health education we need? I know many of certainly the public hospitals, Lincoln and North Central Bronx and Jacoby, they all work on that. Talk to me just about that component.
Obviously,
For seniors.
the key is education in this. It's about portion control. Obviously, it's not just about sugar consumption. It's about your overall consumption in
just
balance
understanding.
with fats and proteins. And so there are ways to teach people about what's an appropriate portion size. For example, an apple equals how many strawberries or how many this and that. So you get a sense of how much you can eat of something in safe boundaries. It's a lifestyle illness. A lot of us, I'll speak for myself, are heavier than we should be and don't exercise enough. If you balance nutrition with some exercise, you'll burn the calories and you won't wind up with a lot of people with type 2 diabetes, which occurs in midlife as we age and as we get overweight.
And I'll bring it back to the disparities. So if we talked about income disparities, if there are educational disparities, many of the people you talk about, people who have built our city, many of them did so and came from other countries, didn't have a proper education, but got to work and raised families, and now they're in this situation, and nobody's ever told them.
Right. And sorry.
No, well, go ahead.
I was going to go back to
the disparity.
Yeah,
thing,
and I was going to go back to the caregiving because we're talking about that and families taking care. So, in the average American caregiver takes $7,000 out of their own pocket, out of their earnings every year to help keep their family member at home.
Wow.
If you are Hispanic, it could be 44% of your income. The average Hispanic caregiver is taking 44% of their earnings out of their pocket to keep their mom, their dad, their aunt, their uncle
Why would
taken
that be
care of.
higher for somebody who's Hispanic?
Well, I think their income in general is lower on the average, and so
It's a higher
it's a higher percentage of their
I see.
income. But that amount of
That's
money
true, yeah.
changes the lifestyle. It changes the choices they can make for their own lives, right? And so AARP has been working to try to get a caregiver tax credit for these caregivers so that they can get some of that money reimbursed to them, because otherwise they're going out and paying for groceries, they're going out and paying for different things in the house to make it easier for mom to age in place, ramps or door handles or whatever.
Is it getting support in Albany, the concept?
It absolutely is. Both the head of the aging in both houses, in both the Assembly and in the Senate, are actually co-sponsors of our bill, Senator May and Assemblyman Bronson, and they are very, very enthusiastic about this because we all know the need, right?
Right.
For
You might also
caregivers.
find one of the reasons in the Hispanic culture may be that you have multi-generational
Yes,
sometimes
that's
sharing
right.
a household. And so it makes a more logical connection for that person absorbing the caregiving in the household as opposed to other cultures where you might live in separate housing and they make other arrangements for caregiving.
Let's talk about the separate housing. I mentioned my own mom is in a home nearby, and then the support there, because as they age and get more frail or lose certain faculties, the home can't care for them with what they need, then they need home care. Let's talk about the state of Medicaid. It's been in the national news lately as well. There are concerns about cuts. Give me a general vision. It's working, it's not working, it needs, why don't you draw a picture of it?
When you think about Medicaid, you have to realize why Medicaid was designed. It is a safety net for people. You cannot be without Medicaid, and cuts to Medicaid would hurt New Yorkers more than most other places.
Because we rely on it so much?
Well,
it occupies a large part of our budget.
It does,
State budget.
because there was a need for it. People need to have long-term care services. People need to have all those other services that Medicaid provided. When ACA came in and New York State jumped into it and added more services, we invited people to come into it, right? We invited people to come in and take advantage of these healthcare services so they could remain healthier, right? Because without those services, they would not have good health. And so where are we now that we're going to say, wait a minute, we don't care if you're in good health or not. We don't care if you're going to get the services that you need. I don't think that that's what our society is about.
We talk obviously very directly about the borough of the Bronx in New York City. How do people upstate, in upstate New York and rural counties upstate, they have the same issues,
Absolutely.
right?
In many ways, it's even
Absolutely.
greater challenge.
Actually, I'm sorry to interrupt, but people don't realize this, but the city in New York State that has the highest level of poverty is Rochester. So absolutely they're feeling it upstate.
You add what you want, and then I want to get to the gentrification piece before we run out of time.
In rural areas, it's the greatest challenge to get access to health care. Obviously, to get caregivers that are non-family to get to the home. Transportation is a big issue.
Yeah.
So
How you're going to go the 8 miles to the, we've all driven on those beautiful farm roads upstate.
Right. And there's no public transportation, and with the wages as they are, it's
You
hard
really
to get a
need
caregiver.
some support for the caregiver, because even the driving is money. Let's talk about this. I thought it was one of the most interesting parts of the report, that gentrification, which has its own implications in the borough of the Bronx, has been a factor here in making it tougher for seniors. Explain why and how.
Oh, absolutely. Well, if you look at I'm going to go back to the income, right?
Only have a few minutes, so go right to it.
All right. So in 10 of the 11 officially designated gentrified neighborhoods of New York, the white income of the 65 and over is $100,000 more than for African Americans or for Hispanics.
And I'm going to just call out, because people in the Bronx know our neighborhoods. Belmont, Crotona, Tremont, Park
Yes.
East are home to those residents, and also the neighborhoods that was pointed out in your report, Hunts Point, Longwood, and Melrose.
Yes.
These are the neighborhoods that you're talking
And
about.
40% of the people there are living below the poverty level. And anything that would affect them losing their homes, they could not replace the rent that they're paying in those neighborhoods. They couldn't afford to remain in those neighborhoods where they raised their children, where they supported the local PTAs and churches, et cetera. They would have to leave those homes.
The question of gentrification, the question of development is probably larger than the AARP can handle. What are the kinds of suggestions that you think are realistic to help people who are caught on the lower end of the spectrum?
Well, one of the things we'd like to see the state is to introduce something called Right to Counsel. New York City put it in last year in the City Council, and basically, if you're facing eviction, you would be supplied with a legal aid attorney. And we know, and because before this, 80% of consumers who went into court did not have an attorney, and yet every landlord walks into court with an attorney. And so it's not surprising who is winning those court battles. But now with Right to Counsel, we are literally turning the tables on that in New York City, and we believe we can do that in New York State also.
It's a fascinating thought, because we talk on this program all over the Bronx about the effects of people being displaced and all those other issues that come about. But I guess lost in, and that's why I was so interested, frankly, when I heard about the report, you don't think about seniors particularly being caught, and then of course the caregivers because they're getting older, and it's the implications that we talked about.
And I think also because when we talk about foreclosure, it's not just about the apartment owner or the homeowner. If the landlord goes into foreclosure on their property, what happens to all the people who rent in that building then? It's the same thing. They're out of luck.
Well, and all the businesses and the things you rely on, the people that you went to get food and things like that, that all changes too with gentrification. So all these changes, I mean, seniors are faced with a series of losses: the loss of independence, loss of function, loss of connections.
Have you had to deal with housing issues? I mean, in addition, I realize Riverspring works on health. We understand that.
Yeah,
but does that come up?
Yeah, Riverspring has worked on the larger organization has worked on some supported housing, and in fact, in one instance I'm aware of, they developed some new housing. And part of it was you got certain credits and you had to have a certain percentage of homeless. And so there was a whole process of having homeless people apply for and get housing in beautiful new
apartments. And they came to you, to the health maintenance organization, to help figure out how to do it.
They came to the larger Riverspring. I think Riverspring also, in partnership with New York City, developed this. And so there was a whole process put in place, but it was a nice thing to see that homeless were going to get great housing when we built this new.
Ms. Finkel, I guess since it was your report, we're going to give you the final word on this. To me, what I've learned about this is, number one, you talked about a larger income disparity that I didn't think we were going to talk about. And the second thing is some of these issues, like housing and other things going on in people's lives, you can't separate it from the whole picture, especially for the most vulnerable in our society.
All the choices that we make, they're in the end, they're pocketbook choices, right?
I don't want to take it any further because we don't know what will or will not happen. But the question of losing or cutting to Social Security or Medicare, I think I can't imagine. I'm sure you can't imagine. Either of you can imagine what it might be if, in fact,
it would be unconscionable. 90% of people in New York who get Social Security depend on it for 50% or more of their retirement income.
Well, which would not be a surprise. I mean, given what we know about seniors and how they live.
Well, I think it's also about younger generations saving.
Right.
The average 401k has $25,000 in it. That's not going to buy you a whole lot of luxury in retirement.
Beth Finkel from AARP, thank you so much.
Thank you.
And Bob Manley from Riverspring Health, thank you so much.
Thank you, Gary.
If we sat here, we could probably do another hour about this. There's some very, very serious and important subjects that relate to all of us, really. Who doesn't want to have grandma or grandpa live as long as they can?
Well, we're getting older.
I guess so. As I said, it's the good news and the bad news. Folks, if you have further questions or comments on anything you heard on tonight's show or anything going on in the Bronx, email them to us at BronxTalk@BronxNet.org. You can send us a tweet at BronxTalk, or you post them on our Facebook page. We thank our guests. We thank our producer, Helen Greenberg, our director, Nick Marrero, the cast of thousands who are with us. You know what's going to happen? We'll see you next week. Good night.